Welcome. I'm Dr. Thomas Gerber, one of the Associate Editors of Mayo Clinic Proceedings. In this recording, I will focus on the articles that our Editor-in-Chief, Dr. William Lanier, has chosen to be featured on the cover of the March 2013 print journal. This month's Editor's Choice is the original article entitled "The Medical Marriage: A National Survey of the Spouses and Partners of U.S. Physicians," which was authored by Dr. Ty Chanefeld from Mayo Clinic in Rochester, Minnesota, and colleagues from several other national healthcare institutions. They found that the spouses and partners of U.S. physicians report generally high satisfaction with their relationships, and that the mean time spent with their physician partners each day appears to be a dominant factor associated with relationship satisfaction. The accompanying editorial, entitled "Medical Marriages: Time-Sensitive Bliss," was authored by Dr. Mary Warner, an anesthesiologist from Mayo Clinic in Rochester, Minnesota, who is married to another Mayo Clinic anesthesiologist, and co-authored by her two daughters-in-law, one of which is a resident and the other a medical student, and who are both married to physicians themselves. This month's first featured highlight is an original article entitled "Combined Use of the Novel Biomarkers High Sensitivity Troponin T and ST2 for Heart Failure Risk Stratification versus Conventional Assessment," authored by Dr. Joseph Lupon from Hospital Universitario Germans Trias y Pujol in Badalona, Spain, and colleagues from several other Spanish healthcare institutions. They found that a multi-marker strategy seemed useful for stratifying risk in chronic heart failure, but that adding in NT-proBNP to the new generation biomarkers had limited effect on risk stratification. This month's second featured highlight is an original article entitled "Maximal Estimated Cardiorespiratory Fitness, Cardiometabolic Risk Factors and Metabolic Syndrome in the Aerobic Center Longitudinal Study," authored by Dr. Conrad Ernest from the University of Bath in Bath, England, and colleagues from several U.S. healthcare institutions. They found that cardiorespiratory fitness demonstrated a strong inverse relationship with metabolic syndrome in both sexes, with the strongest single associative component being waist circumference. This month's third featured highlight is a review article entitled "Mesenteric Venous Thrombosis," authored by Drs. Ashwani Singhal, Patrick Kamath, and Ayalu Teferi from Mayo Clinic in Rochester, Minnesota. Dr. Teferi is also an associate editor of Mayo Clinic Proceedings. The authors provide algorithms for the management of acute and chronic mesenteric venous thrombosis to help readers understand and remember the approach to these conditions. The original article entitled "Comparison of the Effectiveness of Varenicline and Combination Nicotine Replacement Therapy for Smoking Cessation in Clinical Practice" was authored by Drs. Leonie Brose and Robert West and John Stapleton from University College London in London, England. They found that the relative effect of medication varied substantially according to clinical practice and population treated, and that on average varenicline was marginally more effective than combination nicotine replacement therapy. The original article entitled "Impact of Cardiorespiratory Fitness on the Obesity Paradox in Patients with Heart Failure" was authored by Dr. Chip Levy from the John Ochsner Heart and Vascular Institute in New Orleans, Louisiana, and colleagues from several other national healthcare institutions. Dr. Levy is also an associate editor of Mayo Clinic Proceedings. The authors found that cardiorespiratory fitness, as assessed by peak oxygen consumption, modifies the relationship between body mass index and survival, and that using body mass index to assess risk in patients with systolic heart failure may be misleading unless cardiorespiratory fitness is also considered. The original article entitled Fresh Frozen Plasma Dosing for Warfarin Reversal, a Practical Formula, was authored by Drs. Armin Rashid and Raymond Tahan from the Eastern Virginia Medical School in Norfolk, Virginia. Based on a review of data on adult patients who received a total of almost 8,000 units of fresh frozen plasma for warfarin reversal, the authors developed a formula that provides a practical and accurate method to dose fresh frozen plasma for warfarin reversal. The concise review for the clinician, entitled Current Issues in Contraception, was authored by Drs. Mary Marnack, Margaret Long, and Petra Casey from Mayo Clinic in Rochester, Minnesota. Readers who engage in the teaching exercise provided by this article and who complete the appropriate documentation can receive up to 1 hour of continuous medical education credit. Video interviews are available with authors or co-authors of the articles on medical marriages, use of biomarkers in heart failure, fresh frozen plasma dosing, cardiorespiratory fitness vis-à-vis the obesity paradox and the metabolic syndrome, and mesenteric venous thrombosis. These interviews can be found on the homepage of Mayo Clinic Proceedings at www.mayoclinicproceedings.org in the lower right-hand corner. Many more videos, indexed by journal issues and by themes but also freely searchable, are available on our YouTube channel at www.youtube.com/mayoproceedings. Also on our website, our series entitled Meet the Mayo Clinic Proceedings Editorial Board and Staff this month features Margaret Wentz, who has been with Mayo Clinic Proceedings since 2000, currently as an editorial assistant. Ms. Wentz also authors the Art at Mayo Clinic feature on our homepage. As you well know by now, you can find on our homepage a number of online-only features that are not available in the print journal, such as extra residence clinics articles, medical images, stamp vignettes, and other materials. Also, please follow us on Twitter at www.twitter.com/mayoproceedings to learn about online first publications in Mayo Clinic Proceedings and newsworthy developments related to our journal. Dr. William Lanier, Editor-in-Chief of Mayo Clinic Proceedings, the entire editorial board and I sincerely hope that you will enjoy these and the other outstanding articles in the March 2013 issue of our journal. We are sincerely grateful for your interest in and continued loyalty to Mayo Clinic Proceedings. As a preview, the April 2013 issue of Mayo Clinic Proceedings will contain articles on Institution-wide QT alert system identifies patients with high risk of mortality, diagnostic yield of electroencephalography in a general inpatient population, and my approach to the treatment of scleroderma. Our April issue will go live on our website on April 1st, 2013. We'll see you then.
We hope you benefited from this presentation based on the content of Mayo Clinic Proceedings. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you're interested in more information about Mayo Clinic Proceedings, visit our website at www.mayoclinicproceedings.org. There you will find additional videos on our YouTube channel, and you can follow us on Twitter. For more information on healthcare at Mayo Clinic, please visit www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.